Hello everyone. In today's lecture we are going to be talking about depression and antidepressant drugs. So what depression is, it is actually a feeling of sadness and hopelessness. In this condition, the patient actually feel inability to experience any pleasure. In any of his or her usual activities, and he can also have disturbance in sleep cycle or sleep patterns. He also experienced loss of appetite or change in appetite behavior. He also feel loss of energy, and there can be also presence of some suicidal thoughts. If we talk about the pathophysiology of depression, what actually happened that there is decrease in the concentration or production of norepinephrine or serotonin. So there is decrease in the concentration of norepinephrine or serotonin in brain, which actually result into depression. So this thing actually lead to a theory which is called as biogenic amine theory. According to this theory, it is said that depression is due to deficiency of these two monoamines at certain site of brain. But this theory is actually overly simplified, because after taking antidepressant drug, this thing is immediately recovered, but therapeutic response of the patient takes over several weeks. So it is suggested that reuptake of these neurotransmitter is only the initial effect of the drugs, but it is not directly responsible for antidepressant effects. So this bioamine theory is actually overly simplified, because reuptake of these neurotransmitters is actually immediately been recovered by antidepressant drug, but the therapeutic response of the patient for antidepressant effect is not directly stimulated. So what antidepressant drugs do is that they potentiate the effect of norepinephrine or serotonin directly or indirectly in brain, which in turn cause the increase in the presence of norepinephrine or serotonin in brain, which result into antidepressant effect. So this is how antidepressant drugs actually work. So we have different classes of antidepressant drugs, which are SSRIs, which stand for selective serotonin reuptake inhibitors. Selective serotonin reuptake inhibitors. They actually inhibit the reuptake of serotonin neurotransmitter, and which result in increase in the concentration of serotonin in synaptic cleft. And the next class include serotonin norepinephrine reuptake inhibitors. They inhibit the reuptake of both serotonin and norepinephrine, and in this way there is increase in the concentration of these neurotransmitters in the synaptic cleft, which cause increase in the response of these neurotransmitters. And the next class is atypical antidepressants. And the fourth one is TCAs, which stand for tricyclic antidepressants. And the next one is monoamine oxidase inhibitors, which are known as MAOIs. So they actually inhibit the enzyme present for the degradation of serotonin or norepinephrine. So in this way they will increase the concentration of these neurotransmitter for the cellular responses. So today we are going to be talking about MAOIs, which are actually monoamine oxidase inhibitors. Monoamine oxidase is actually an enzyme which is present in different tissue, like it is also present in nerve, it is present in liver, it is also present in gut. So it is present in different places in our body. So what it does in neuron or in nerve, it acts as a safety valve to oxidatively deaminate any of the excess neurotransmitter present in the neuron, because sometimes there may be leak out of synaptic vesicle when the neuron is at rest, because at rest there is no action potential, and when there is no action potential there should be no leakage from the synaptic vesicle. But if there is some problem in the synaptic vesicle and neurotransmitter leak out, for such cases there is the presence of monoamine oxidases, and the function of this enzyme is actually that it oxidatively deaminate the released neurotransmitter, and in this way it actually degrade the neurotransmitter which is leaked out, so that this leaked out neurotransmitter could not cause further cellular responses. So what these monoamine oxidase inhibitors do is that they reversibly or irreversibly inhibit or inactivate the enzyme which is causing this inactivation of neurotransmitters. In this way there is more of the neurotransmitter in the synaptic cleft, and there will be more of the cellular response which is required in antidepressant agent. They actually enhance the activity of neurotransmitters such as norepinephrine or serotonin. So this class include agents like phenalzine, tranylcyproamine, isocarboxazid, and seligline. These four agents are involved in this class and they are used for their antidepressant activity. So one thing about seligline is that it is also used for the treatment of Parkinson's. Another important thing about seligline is that this is the only antidepressant which is available in TDDS, that is transdermal drug delivery system. So it is the only antidepressant which is available in this form of drug delivery system. One thing about all of the agents which are included in this class is that Their use is limited due to complicated dietary restrictions required while taking these agents, because these agents actually interact with much of the food, so therefore their use is much limited, because patient cannot always control his diet, because he can forget about what to take and what not to take at many times, so it becomes very difficult for the patient to handle such conditions. So therefore its use is much limited now. Let's see if this is the presynaptic neuron and this is the postsynaptic neuron. Over here there are different receptors present for the binding of neurotransmitters. So when there is no action potential and neuron is at rest, so what happens if there is some release of neurotransmitters from the vesicle into the cytoplasm of the neuron? What will happen, that there is presence of an enzyme which is called as MAO, Monoamine Oxidase enzyme. This enzyme inhibit or degrade this released neurotransmitter molecule, so that there will be no further leakage into the synaptic cleft of this neurotransmitter. But when there is presence of MAOI, what happen is that it inhibit this enzyme which is actually degrading this. So in turn, what will happen? When there is inhibition of this enzyme, there will be ultimately inhibition of this activity, and there will be no more degradation of neurotransmitter which are being leaked from the synaptic vesicle into the cytoplasm of the neuron. And when there will be arrival of the action potential, there will be ultimately release of neurotransmitter from synaptic vesicle. Now not only neurotransmitter from synaptic vesicle, but also the one which were leaked from the synaptic vesicle when the neuron was at rest, those neurotransmitter will also be released into the synaptic cleft, and in this way there will be much more of the cellular responses by the neurotransmitter which are present in the synaptic cleft, and there will be more of the antidepressant activity by the neurotransmitter, because now there is more of the serotonin or norepinephrine present in the synaptic cleft, which can show their cellular responses through binding with the receptors. So in this way, this is what we are getting from MAOIs. So this is how they work. So if we talk about the mechanism of phenalzine, phenalzine actually irreversibly inactivate the enzyme, which result in increased stores of norepinephrine, serotonin and dopamine within the neuron, and subsequently diffusion of excess neurotransmitter into the synaptic space. These drugs inhibit not only MAO in the brain but also which are present in liver and gut. As I have told you earlier that this enzyme is also present in different tissue of body which include liver and gut. So this enzyme is also inhibited by the drug phenalzine or other MAOIs. What is the function of MAOs in liver and gut? Over there, this MAO is actually required for oxidative deamination of toxic substances and drugs. So when there is no more presence of this enzyme because of the drugs we are taking, so what will happen, that there will be increase in the concentration of toxic substances and drugs, which will ultimately cause some side effects. Tyramine, which is a common substance present in certain foods. When this substance is increased inside the body, there is a toxicity built up inside the body called as tyramine toxicity. Whereas seligline, which is present in TDS form, that is transdermal drug delivery system, so in this way there is patches of seligline being applied on the patient's body. In this way there is less chances of first pass metabolism, and in this way there is less of the inhibition of MAO, which is present in gut or liver, and therefore it causes less of the toxicity which is usually caused when there is inhibition of this enzyme. So seligline can avoid this toxicity. If we talk about the actions of monoamine oxidase inhibitors, these inhibitors can actually inhibit monoamine oxidase enzyme after first intake, but their therapeutic response require the intake of these agents for up to 2 weeks. Because their therapeutic response is different than that of their initial step for their antidepressant activity. Out of these agents, seligline and tranylcyproamine can cause agitation. Not only this, it can also cause insomnia. Uses of monoamine oxidase inhibitors include they are used for the treatment of depression, who are unresponsive or allergic to TCAs or SSRIs, or who experience strong anxiety. And a special subcategory of depression which is called as atypical depression may also respond preferentially to monoamine oxidase inhibitors. Because of their risk of drug-drug and drug-food interactions, monoamine oxidase inhibitors are considered as last-line agents in many treatments. So, we do not use these agents very often. So, next we are talking about the pharmacokinetics of these agents. These agents are well absorbed orally. Monoamine oxidase inhibitors actually inhibit monoamine oxidase. So these enzymes actually require several weeks to regenerate after the termination of this drug or these agents that are monoamine oxidase inhibitors. So if a physician wants to change the therapy of a patient who is taking antidepressant, that is monoamine oxidase inhibitors, and now he wants to change to another class of the antidepressant, so he should wait for at least 2 weeks so that there is regeneration of these enzymes, and after that he can initiate other round of antidepressant of any other class of antidepressant agents. Because if he does not wait for the regeneration of enzyme, and if he give another glass of the antidepressant to the patient, what will happen is that there will be increase of the neurotransmitters in his brain, and this will cause serotonin syndrome and many other adverse effects. So there should be delay of at least 2 weeks after the termination of monoamine oxidase inhibitor therapy. And after 2 weeks there will be regeneration of the enzyme, and then he can prescribe any other antidepressant he wants to give to the patient. These agents are metabolized hepatically, that is through liver, and after that they are excreted through urine. So now let's talk about tyramine toxicity. Tyramine is actually present in many food. It is present in cheese, meat. It is also present in chicken liver and pickles or smoked fish. It is also present in red wines. So when it is present in all of your food and you intake that food, it is being degraded by monoamine oxidases, which is present in gut. But when you take monoamine oxidase inhibitors as antidepressant, what these antidepressants do is that they not only inhibit the monoamine oxidase which is present in your neuron, but also they also inhibit the monoamine oxidase which is present in your liver and in your gut. But when there is inhibition of this enzyme in your gut, what happens is that this tyramine is not being degraded by monoamine oxidases, and in this way what happens is that there is increase in the concentration of tyramine. And what this tyramine do is that this tyramine cause the release of catecholamines from nerve terminal. So because of the increase of tyramine, there is release of catecholamines from nerve terminals, which results into hypertensive crisis, which is a very serious condition with signs and symptoms such as occipital headaches, stiff neck, tachycardia, nausea, hypertension, as its name indicates. It is a hypertensive crisis. Not only this, it also causes cardiac arrhythmias and seizure, and sometimes it also causes stroke, which can be life threatening. So these are the things which can be caused due to increase in the tyramine because of the inhibition of monoamine oxidase. Therefore, patient must be educated to avoid any tyramine containing food. Not only this monoamine oxidase inhibitors can also cause different adverse effects like drowsiness, orthostatic, hypotension, blurred vision, and constipation, dry mouth. It can also cause serotonin syndrome. And what is serotonin syndrome? We have talked about this in our previous video. Serotonin syndrome occur when there is increase in the concentration of serotonin present inside the brain. Therefore, MAOIs should not be taken along with any other antidepressant drug because it can increase the concentration of serotonin present in the brain to the dangerous level. As I have told you earlier that monoamine oxidase inhibitors require washout time of at least 2 weeks because enzyme require at least 2 weeks to regenerate. So we should not be giving any other kind of antidepressant to the patient who just has terminated the monoamine oxidase inhibitor therapy. So we should give at least 2 weeks so that his enzyme could regenerate, and after that we can give any other kind of antidepressant therapy. So this was all about monoamine oxidase inhibitors. If you have any question, let me know in the comment section below. And thank you for watching my videos.